This is the second video of the abortion or miscarriage series, and in this video we will be discussing about biochemical pregnancy and biochemical pregnancy loss. Welcome back to your own YouTube channel Mind Body Tonic, and this is Dr. Sita with you again. As I promised you all, I am back again with another video in the miscarriage series. Miscarriage in the early weeks of pregnancy is quite common. More than 50% of all pregnancies end in spontaneous miscarriages, most of them even before a woman realizes that she is pregnant. And biochemical pregnancy loss is the most common type of miscarriage which occurs in the early weeks of pregnancy. What is biochemical pregnancy? Biochemical pregnancy is where the initial pregnancy test either in the blood or in the urine is positive, but it does not progress to a state where it can be detected by ultrasonography. It may sound like a false positive test, as if the patient was not pregnant at all. To the patient, it is very confusing. The question that usually arises from a patient is, how can I be pregnant 2 days ago and not be pregnant today? The truth is that biochemical pregnancy was indeed a conception, and it was a very early miscarriage. Here, the implantation takes place. That is why there is a temporary rise in beta HCG, which shows up as positive test in the blood or in the urine. But the pregnancy does not progress further, and on ultrasonography, gestational sac does not appear. The beta HCG level will be usually less than 100 units, and rather than rise, it will fall rapidly in the next few days or week. Or a positive pregnancy test will become negative and the woman will get her period. Now, how commonly do biochemical pregnancies occur? They are said to occur more frequently after embryo transfers following IVF. However, even in spontaneous pregnancies, they are thought to be very common and involves as much as 50% of all pregnancies. An accurate number is very hard to determine because many women who undergo biochemical pregnancy loss do not even realize that they are pregnant in the first place. Unless, of course, they are actively trying to become pregnant and are checking their beta HCG or urine pregnancy test even before the expected day of period. And that is exactly why more and more biochemical pregnancies are being detected these days due to these ultra-sensitive beta HCG assays available, which can detect a pregnancy even before a woman misses her period. Why do biochemical pregnancy losses occur? The usual cause is a chromosomally abnormal embryo trying to implant. It is nature's way of seeing to it that only the fittest survive and the rest get aborted. They can also be due to any problems involving the endometrium, anatomical issues, immunological issues, or blood flow related issues, and that may prevent healthy implantation of an embryo from occurring. There are many studies which prove that excess stress during those 2 weeks following ovulation IUI or IVF can lead to an increased incidence of biochemical pregnancy loss. This is exactly the reason why I keep telling everyone to remain calm and cool during this important 2-week period. Another risk factor for experiencing biochemical pregnancy loss is increase in the sperm DNA fragmentation. This can occur due to various reasons which can cause oxidative stress. Many studies have shown that when there is an increase in the sperm DNA fragmentation, then there is an increased risk for experiencing biochemical pregnancy loss. Getting a sperm DNA fragmentation test done is not always cost effective and not practically feasible also. Neither it is needed. What we need to do is to find ways to reduce oxidative stress that the sperms may face. And there are many methods by which we can do this. We will discuss about all that in a separate video as it is really important for all of us to know about it. Now, how to deal with the biochemical pregnancy loss? Is there any treatment that we need to take? There is no treatment for biochemical pregnancy loss. The only thing to make sure is that if at all beta HCG levels were positive initially, it declines to undetectable levels so as not to miss out an ectopic pregnancy. However, the most difficult aspect of dealing with a biochemical pregnancy loss is the psychological trauma that it brings, the initial false hope it brings, the excitement of finally having a positive pregnancy test and then to deal with the disappointment of not being pregnant. For many couples, this can be the last straw which breaks the camel's back. Many find it easier to deal with a negative beta HCG test than to deal with an initial hopeful result which then becomes negative. The commonest questions that people ask after biochemical pregnancy loss are: why did this happen? Did I do something to harm the embryo? Does this mean that I am never destined to have a baby? Does this mean that my uterus is defective and is rejecting the baby? No, none of this is true. The fact that beta HCG test is positive means that implantation has indeed occurred, that processes till that particular point has occurred properly. And that is any day better than a negative beta HCG test, isn't it? The chances of having a successful, healthy pregnancy in the future is very much more than in a person with a negative beta HCG test. That is for sure. As I told you before, many a times it is due to an abnormal embryo which is anyways better off being aborted. Be reassured that there is no negative impact on future pregnancies at all. And once correctable factors like increased sperm DNA fragmentation, endometrial factors, if at all there are any, are dealt with, then the prognosis is definitely good. So stay positive and be hopeful and optimistic. This is all for today. In the next video, we will discuss about an embryonic pregnancy which was previously known as blighted ovum. Please do share the link of the video and the channel with others. And please do subscribe to the channel if you have not yet done so. And yes, remember to click the bell icon too so that you will never miss any notification whenever I post a new video. See you soon with another video. Till then, take care of yourself and your loved ones and stay blessed.